So broken heart syndrome is a condition where the heart muscle gets suddenly weak because of some traumatic event in a patient's life, such as a loss of a family member, some financial or personal loss that causes a surge of adrenaline or other stress hormones in the body that actually poison the heart muscle, cause it to suddenly lose strength, and because of that can lead to other complications like strokes, severe heart failure, or even in some cases death. The formal name for broken heart syndrome is Takotsubo cardiomyopathy, which gets its name from the octopus trap in Japan called Takotsubo. That is, the way that the heart actually looks like when it's failing resembles that octopus trap in that it's weak, particularly at the bottom portion of the heart, which causes it to almost balloon out and get very dilated. The symptoms of broken heart syndrome can mimic those of heart attacks or even strokes. Can oftentimes be associated with chest pain, shortness of breath, dizziness, excessive sweating, or even passing out. The best thing for bystanders to do if they are witnessing somebody potentially having broken heart syndrome, because the symptoms oftentimes mimic those of heart attack, is to first call 911. And then, while waiting for 911 to arrive, if they are CPR certified, to initiate CPR on the patient if that is what is needed, if the patient has lost a pulse or needs assistance with breathing. Other things that they can do, the bystanders can do, is to have the patient lie down, potentially elevate their legs if that might help. And then also it wouldn't be, it could be helpful to give aspirin because there is a chance that that patient is actually having a true heart attack, so it wouldn't withhold that from them. So there are certain people who are more prone to broken heart syndrome. The research shows that broken heart syndrome usually affects women more than men. Almost 80 to 90% of the cases of broken heart syndrome afflict women. Also, most of those women are in the later years of life, in their 70s, 80s, and 90s. But what is helpful is to have sort of a balanced lifestyle that where you can deal with stress and these sorts of situations in a healthier manner and have friends and family around, and that may sort of provide that added support even for the heart.